Yeah, and wellness is a key part of it all. And and as we talk about a lot, wellness is having what I call a reset in the marketplace too. Is that employers are stepping back and saying, how do they do it better? And how they look at it truly with a different ROI scope and what's its impact on health and productivity. And joining us this morning to talk about what they're doing in this space is Rich Bedrosian, the Director of Behavioral Health Care, and Bobbi Coluni, the Head of Strategic Product Management at Johnson & Johnson Health and Wellness. Good morning, Rich and Bobbi. Good morning.
Good morning.
Hey, good to have you on here. Bobbi, good to talk to you again.
Yeah, nice talking with you too. It's been a while.
Yeah, it has. Hey, Rich, if you'd start us off, I would appreciate it. Kind of give us a backgrounder on Johnson & Johnson Health and Wellness Solution. What you guys are doing and kind of the depth of your services, and then we'll talk about your white paper and, talk about My Health Discovery.
Well, J&J Health and Wellness Services is really dedicated towards improving health-related behaviors across a very, very broad spectrum of health initiatives. So we provide digital health coaching to a variety of organizations, healthcare systems, and healthcare payers like Kaiser Permanente. So millions of people are using our digital health coaching programs. But we also work internally within J&J to bring behavioral science into other J&J products targeting other disease states and various consumer needs so that we can improve outcomes in those products and increase consumer satisfaction. Bobbi, anything you'd like to add to that?
No, I think you hit it, Rich.
If you both kind of give a perspective, and Bobbi, you can start, talk about, health assessment. It is kind of having a reset too. And so what are you guys doing? You wrote a recent white paper entitled Reimagining the Health Assessment. And if you need to talk about that, I'd appreciate it.
Sure. Health assessments have been around for a long time, and when you look at the health assessments that are used today, they really haven't changed very much from back in the 1970s, 80s when they first were created. In fact, many of the health assessments were taken from paper format and put onto the web. And now as we really think about how people are interacting with technology on mobile devices, there was a problem we recognized and an opportunity to really change how we collect information about people's health in order to give them feedback and also for payers provide insights on population health. So we did two things. One, we started with a usability study and really tried to understand the user experience of using health assessments. And what we found probably wouldn't surprise you if you've taken one yourself recently. They feel long, somewhat like an interrogation rather than something that people are getting value from themselves. We found that people sometimes felt that they were being judged or scored, and that was sometimes demoralizing because it didn't really always reflect how people felt about their health. So, for example, one of the people in the study was really proud about some of the positive things he was doing for his health, but had high cholesterol and felt that was the thing that was really ringing so loud and clear from the feedback he was getting from his health assessment. We also found that the use of scoring, a score that someone might get from the health assessment made people feel like they were reluctant to share information honestly, and that it was sending a message that this is a game, so I'm going to try to optimize my answers to get a higher score if that's the purpose of this. So all of these insights we used as we went through a process of reimagining, and I'll let Rich talk about another aspect of what we did, which was a predictive validity study to really try to get at how to shorten the health assessment while still maintaining a lot of predictive power for our payers, employers, and health plans and health systems who use this information. Rich, do you want to speak to that?
I think that sometimes in the past we've looked, and probably all of us, as Bobbi said, have taken a health assessment through our health plan or employer. We looked and wondered, where these questions come from and how many things are they going to ask me for. And health assessments have played a very important role in understanding population health risks. Having a group of people in a health plan really indicate what kind of health behaviors they're engaging in or not engaging in, and identify needs that could be addressed through a variety of interventions. So we still, in this health assessment, wanted to be able to measure the classic 10 health risks, the hero risks they're often called, that account for a tremendous amount of health expense and negative health outcomes, things like poor nutrition, exercise, etc. But we wanted to do it with fewer questions. And then we really wanted to bring in a number of other variables that we think play an important role in health behavior, especially on the psychological end. So, what we needed to do and what we were able to do with a large national sample was give a very large item pool to people and start to cull down and winnow down the number of questions. So we were able to measure a lot of the same variables that we always measured, but with a lot fewer questions. And we did this through statistical procedures, so we could find, for example, that 3 questions to measure something like mindfulness or 2 questions to measure stress could serve to measure it as effectively as, 7 or 8 questions, for example. But we also added in a lot of other items. So, several of these are probably going to be familiar to everyone. One was, we wanted to look at sitting, not just exercise, because it's been found that independent of whether people meet exercise guidelines, the amount of time that they spend sitting is in itself an independent health risk. So we wanted to assess that. There's a growing body of research that shows how much mission and purpose relates to not only things like longevity and physical health, but also relates even to things like how often people participate in health screenings. So we wanted to measure mission and purpose. We wanted to look at things like values. I mentioned mindfulness and so forth. So what we wanted to emerge with was not only a picture of the individual's health risks, but an understanding of the psychological factors that could be influencing their ability to take action to improve their health.
That's very interesting. There's it's the depth of what we're looking at. Step back and looking at what truly, health and wellness is. To your points. But let's come back and talk about the health assessment itself. And Bobbi, you kind of alluded to it. And there's kind of a minor debate out in the industry with all this mobile technology and this consumer technology being able to be deployed by employers or health plan for the member and employee populations. That do we really need, a health assessment? I mean, I have my opinion on that, but what are both of your thoughts on that?
Yeah, this issue has come up in my whole career. I've heard employers at certain points say, I don't think these will be around in another 10 years. This was back in the 90s. I remember hearing this debate. I still think that there is information that comes from a health assessment that we can't obtain from other areas, and I think this is often the individual's perception of their own health, which itself can be highly predictive. But information in the health assessment, such as motivational quality, learning a little bit about, more insights than you might get from assembling information from claims data or other clinical sources. And, when we look forward, we see that and even today, people are putting together a health profile from multiple sources of data. But the health assessment from individuals directly does give us a lot of insight that we don't have. And we, I always remember that there's 75% of people who aren't interacting with the health system at all in a particular year. And for those individuals, the health assessment can be the only source of information that we gather on those people. Rich, do you have anything to add?
You just hit on a very, very critical point. And being a clinical psychologist, I'm particularly interested in mental health and conditions like depression. And we know that people with mental health difficulties are very, very unlikely to even come forward into the healthcare system and often then go undiagnosed and untreated. So when you use a health risk assessment to potentially reach out to millions of people, one of the things that we know that you do is you begin to identify problems like depression, like stress, even like insomnia, that aren't going to go diagnosed or recognized unless they reach, really monumental proportions. So it gives you an opportunity not only to identify individuals with these difficulties, but now to begin to triage them to appropriate services. So I think it serves such an incredible purpose in mental health. I really hope they never go away.
Yeah, I tend to agree with you too. Let's talk a little bit about how do you define success when engaging consumers through connected health, and what are the sustainable and meaningful outcomes that we're all seeking here? Bobbi, you want to start?
Sure. And just to recap on sort of the outcomes of our studies and how it feeds into this new reimagined health assessment and what outcomes we are looking for through it, there were really three things that we were able to achieve out of the learnings from the usability and predictive validity study we did. The first was really having a shortened question set that really uses new science and uses information about what questions are most predictive so that we could be very judicious. The second is this reimagined user interface, and one of the key outcomes we were trying to derive there is to get people engaged in their health. So we did a number of things in terms of the organization of the questions, using some game design in how we presented the interface, and we used this concept of what we call get, give, which is we're getting some information, we're getting a little more information, and then we're giving feedback along the way. And we think that will really drive more engagement, and we're seeing that in our studies so far, to really intrigue people, provide feedback that will encourage them to take that first step. We also have changed the tone, and I talked a little bit about the judging sense that people sometimes get through taking a health assessment. We really work to be encouraging and positive in the tone and celebrate what people were doing well, and try to encourage them then to take that next step to improving some areas that they hadn't tackled or had more barriers around, in a way that builds off the good and develops more confidence for them. And the last thing is that at the end of the assessment, we work very hard to present a tailored set of resources based on what we've learned about an individual that encourages them to engage with other coaching programs we provide. So it's an opportunity to leverage all that information we've gathered, and real time, as we're still interacting with that person, invite them to move on and utilize some of our coaching programs that are directly relevant to their needs. Rich, anything you'd like to...
Yeah, one other, and I think, back to what counts for success, I think the most important thing that can come out of an assessment like this is to motivate somebody to take the next steps for their health. And as Bobbi said, we tailor the feedback that people get down to the sentence fragment often to show people that we understand them, that we've heard what they've told us, and to provide information or feedback for them that's directly reflecting what they've told us about themselves. And another thing that we try to do is we offer people several action steps at the end of the experience to encourage them to take some of the next concrete steps to improve their health. So we don't just want to tell them, look, you're eating badly, you're not exercising well, and you're generally a mess. We're really trying to give people a sense of there are some positive steps that they can take right now that aren't out of their realm, and see if we can get them at least started on some behavior change.
Yeah, and to that point, we do use this very nurturing coaching tone throughout the interface. So we're letting people know, they're not alone. We're letting people know we are hearing what they're saying. There's a very empathetic interface here. And in addition to using some humor and things that strike curiosity, that all is packaged together as an invitation to engage. So engagement really is one of the number one metrics that we're looking for, in addition to helping people drive their awareness and take that first step.
And one of the single biggest challenges and opportunities that we have in this space is engagement across the compendium. Well, we're at the end of this segment, Rich and Bobbi, and I really appreciate you joining us, but I want to give you each a chance to leave our audience with one or two takeaways. Bobbi, would you like to start, please?
Sure. I think the biggest takeaway and learning that we had out of this is the opportunity to leverage both technology and science in a way that takes advantage of the great assets we have and the new ways people are interacting with their mobile phone, making it convenient to engage with their health over time. So I think that the information we glean from the health assessment can be used to change the way that people think about their health, specifically by trying to connect it to their life. So it's not just talking about health as something separate, but really helping them discover their what's important to them, their mission, their purpose in life, and thinking about their health and their health goals in the context of that. And I don't think there's any more powerful way to drive engagement than that.
Thank you, Bobbi. Rich?
And I can only echo what Bobbi said. We don't always do a very good job of presenting the value proposition to people for what they can get out of improving their health. And, there are many, many benefits from improving health that can be out in the distance, out in sort of the great beyond, if you will. So, it may be that if I exercise more, my cholesterol numbers are going to improve, my blood pressure is going down. But one of the most immediate things that exercise can do for me is increase my energy and enable me to do the things that are really important to me better. And so, as Bobbi said, we really want to tie in improving health with the things that are most immediately important to the individual, because I think in the final analysis, those are the things that drive us, and those are the things that will enable us to make significant behavior changes. We're not going to do it because our doctors or our health risk assessments tell us to do them. We're going to do them because we see some immediate value for the things that matter to us.
That's good stuff, Rich and Bobbi. Really appreciate it. Great segment. Let us know. Let our audience know how they can get in touch with you, please.
By
Bobbi,
going
would you
to
like to do that?
Sure. So general information about our solutions can be obtained by going to our website, which is J&J Health Wellness Solutions.com. So JNJHWS.com. And was that what you were looking for in terms of more information? Good.
I'd say one thing I'd encourage our users or our audience to do is also take, especially when you get there, take a look at the Science and Insights tab. You can see you can get access to the study Doug referenced earlier. I also happen to really like your video library, and I would encourage our audience to look at how well you've done that. So thank you.
Thank you, Rich and Bobbi. We really appreciate it, and I look forward to talking to you again in the near future. Have a great weekend.
Thank you.
Thank you.